Hi, I'm Rosy, Assistant Professor, Department of Anaesthesia and OT Technology, Yenepoya School of Allied Health Sciences, Yenepoya deemed to be University. Today, I'll be explaining about tracheostomy tube. Specific learning objective. At the end of this session, audience will be able to explain about tracheostomy tube and its parts, differentiate various types of tracheostomy tubes and list the application of tracheostomy tube, explain the potential complications associated with tracheostomy. Introduction. Tracheostomy is a surgical procedure which consists of making an incision on the anterior aspect of the neck and opening a direct airway through an incision in the trachea. Tracheostomy is done when usual route for breathing is blocked or narrowed and is used for long-term use of machine or ventilator to assist breathing. Tracheostomy tubes. Tracheostomy tubes are made of silicone, polyvinyl chloride, polyurethane. The length from tracheostomy stoma to carina is short, so tracheal tubes are non-beveled, shorter and have cuff closer to the tip to avoid endobronchial intubation. This is tracheostomy tube. The tracheostomy tube consists of outer cannula, obturator and inner cannula. The outer cannula consists of pilot balloon. The pilot balloon is used for inflation and deflation of the cuff. It can provide a visual indication for the cuff to prevent the overinflation. The inflation tube is for inflating the tracheal cuff. Cuff is to secure the airway to prevent aspiration, and flange. The flange is used to secure the tracheal tube and prevent the misplacement of the tube, and tracheal strings. The tracheal strings is used to prevent the migration of the tube. This is inner tube. The inner tube consists of 15 mm adapter at the proximal end. The inner tube prevents the secretion and blood and facilitate the proper way for the insertion of the tracheal tube. And this is obturator. The obturator has a rounded tip at the distal end. The obturator is used to prevent the kinking of the tracheostomy tube. Parts of tracheostomy tube. The tracheostomy tube has outer cannula, obturator and inner cannula. Outer cannula fits directly in tracheal stoma. Proximal flange is to secure tube in place and locking inner cannula. When inflated, it prevents air leakage between tracheal wall and outside of the tracheostomy tube. Outer cannula is fenestrated for speech production and preparation for decannulation. Obturator. The obturator is inserted into the outer cannula to facilitate insertion into trachea. Obturator occludes the lumen of tracheostomy tube and patient's airway is removed after the outer cannula in its proper location. It should be kept ready for reinsertion in the event of displacement. Inner cannula. Inner cannula is inserted to the outer cannula and locked. Non-disposable inner cannula is removed only for cleaning. Not all types of tracheostomy tubes have inner cannula. Inner tube should be cleaned 2 to 3 times per day or more as needed. Types of tracheostomy tubes: cuff tube, cuffless tube, single cannula, dual cannula, fenestrated tube and non-fenestrated tube. Cuff tracheostomy tube. Cuff tracheostomy tubes are used in patients who have risk of aspiration and need to use ventilator. Cuff is located in the distal area of the tracheostomy tube and prevent the air leakage. Cuffless tracheostomy tube. Cuffless tracheostomy tubes are used in patients who are not at risk of aspiration. Since there is no cuff, the air can pass into upper trachea, larynx and allow for speaking and coughing. This is used for long-term basis. Single cannula tube. Single cannula have only outer cannula and not inner cannula. Resistance of breathing is lesser in this tube due to large diameter. This soft flexible tube are ideal for patients with low secretion level. Low pressure cuff provides a gentle and effective seal to reduce the risk of tracheal damage. Dual cannula. Dual cannula tracheostomy tube has outer and inner cannula. Outer cannula passes into trachea and size of tracheostomy tube is stated as internal diameter of outer cannula. This dual cannula tube has a removable inner tube which is taken out to clean secretions without removing the entire tracheostomy tube. Fenestrated tube. Fenestrated tube has hole in back of outer cannula that lies below larynx when tracheostomy tube is in place. It allows movement of air through upper airway. Tracheostomy tubes are available with longer stem, phloem cuffs and speaking valves. Non-fenestrated tube. Non-fenestrated tracheostomy tubes are a type of tracheostomy tube that does not have holes or fenestrations in the tube wall. Non-fenestrated tracheostomy tubes may reduce the risk of aspiration as there are no holes. And applications: respiratory failure, to provide a secure airway for ventilation in patients with respiratory failure. Airway obstruction, to bypass an obstruction in the upper airway such as tumor or swelling. Neurologic disorders, to provide a secure airway for patients with neurologic disorders such as stroke. Complications: the early complications include bleeding, bleeding from the tracheostomy site or within the airway, tube obstruction, blockage of the tracheostomy tube by secretions, blood or other debris, infection, infection of the tracheostomy site. And the late complications include tracheal stenosis, narrowing of the trachea due to scarring or inflammation, tracheomalacia, weakening of the tracheal cartilage leading to the collapse of the airway. Summary: tracheostomy is a medical procedure that creates an airway directly into the trachea through an incision in the neck. Components of tracheostomy tube consists of outer cannula, obturator, inner cannula, cuff, pilot balloon, flange, tie ring. Various types of tracheostomy tube includes cuffed, cuffless, single cannula, dual cannula, fenestrated and non-fenestrated tube. Tracheostomy tubes are used during respiratory failure, airway obstruction and neurologic disorders. Common complications are bleeding, tube obstruction, infection, tracheostenosis and tracheomalacia. References: these are my references. Thank you.